Hello, everyone. What we will learn in this task is first aid action for patients with too cold phenomenon. When the survivor gets the rescue, if the survivor appears to cold phenomenon, should immediately take first aid action. The emergency treatment for overcold patients mainly depends on the condition of the survivors at the time and the equipment can be used. Therefore, the task is mainly about how to carry out first aid action for patients with too cold phenomenon. Next, let's familiarize ourselves with the learning objectives of Task 2. Objective 1. Understand the classification of patients with overcold phenomenon. Objective 2. Master the first aid actions for different conditions of patients with overcold phenomenon. Objective 3. Master the test point knowledge of Task 2. Then let's look at the Task 2. Content 1. Classification of patients with too cold phenomenon. Content 2. First aid action for different conditions of patients with overcold phenomenon. Content 3. Test site knowledge test of Task 2. 1. Classification of patients with overcold phenomenon. When the survivor is too cold, the discoverer should immediately understand the situation of the too cold patient at that time, so as to use the appropriate emergency action according to the condition of the too cold patient at that time. Let's first understand the classification of patients with cold phenomenon. The status of patients with cold phenomenon is mainly divided into 4 categories. 1. Patients with too much cold phenomenon are still conscious. 2. Patients with severe overcooling phenomenon. 3. Patients with overcooling phenomenon are semi-unconscious. 4. Patients with overcooling are in coma or suspended animation. Content 2. First aid actions for different conditions of patients with overcold phenomenon. According to the different conditions of patients with overcold phenomenon, appropriate emergency action to achieve rapid rescue effect. 1. Such as too cold phenomenon patients are still conscious. The first aid action is, should take off wet clothes, change on dry clothes wrapped in blankets, rest in the ambient temperature above 22 C, can gradually recover. During the period, patients can be provided with hot milk, white sugar and boiled water, etc. if there is no food for a long time before the rescue. The drink should be diluted and gradually increase the concentration. Special attention. Remember to give patients to drink or alcoholic drinks. Also must not use massage, drugs or alcohol rubbing and other methods to promote the blood circulation of patients. In addition to the use of local warming or fire method is absolutely wrong measure. 2. For patients with severe overcooling phenomenon. The first aid action taken is, patients with too cold phenomenon can be immersed in a bath with water temperature of 40 C, 45 degrees centigrade to restore the body temperature. The bath time is not more than 10 min. Get up and dry and keep warm with the quilt. If the patient's body temperature does not exceed 1.1 degrees centigrade, dip again every 10 minutes until the body temperature returns to 35 C. 3. Such as too cold phenomenon patients in semi-coma, coma or suspended animation. The first aid action taken is to immediately contact the ship or a medical institution on shore to obtain detailed measures to guide the rescue and transport of patients, and to restore their temperature while waiting for the doctor's guidance. Content 3. Test site knowledge test. The knowledge point of this task, we have finished learning. Next, we will carry out the test site knowledge summary assessment. According to the test site test type requirements, let's test the first question type, non-topic. The content of this task, We have finished learning. Thank you all.